Hello, this is Dr. Batts, and I want to talk to you today about an issue facing many Americans. As you all may know, November is Diabetes Awareness Month. Unfortunately, diabetes impacts the lives of over 37 million Americans, almost 11% of the population. Even more concerning is the 96 million Americans who have prediabetes, which is approximately 1/4 or 25% of the U.S. population. Irrespective of the cause, if we don't do something now about the growing rate of diabetes, obesity, and other things in our community, the risk of heart disease is going to continue to rise. The ABC Regional Roundtable series is a series of lectures that are geared to educate providers, energize patients, as well as engage communities in understanding the risk and the linkage between both diabetes and heart disease. The program highlighted one of the more novel agents in the treatment of both diabetes and cardiovascular disease called the Glucagon-1 Peptide Receptor Agonist, or GLP-1 for short. The event juxtaposed real patient discussions and experiences in clinical cases against the contrasting views with respect to policy decisions and how to get patients on it. More importantly, it created a community not only of providers, but also of patients and community leaders that would engage in discussions about risk reduction strategies irrespective of medication use. Now, for me, when I discuss the role of GLP-1s with my patients, it's not a one-stop thing. It's an investment in your life. For me, GLP-1 stands for Giving Lifestyle Purpose, really allowing my patients to jumpstart their lifestyles, whether that's with walking, increasing their ability to rest, knowing how to recover, and various other things that we know have a synergistic benefit, not only on decreasing diabetes and obesity, but also their overall long-term health. This movement has three components, or 3 C's. The first one is clinical, the second is curriculum, and the third is capital. In our clinical phase, or in our clinical step, we want to help providers develop cardiometabolic clinics within their clinic. Secondly, we want to build curriculum, not only to talk about the pathophysiology, but how do you maintain and sustain these cardiometabolic clinics? Finally, capital, whether that's intellectual capital or other strategies to allow physicians and patients to be more engaged in the clinical trials process. Our hope is to diversify clinical trials, whether you're a provider or a patient, having information about how to set it up and how to reach out. As we work down this pathway to reduce the risk and growing concern of diabetes, I understand that this sounds like a huge mission. But one thing that I've learned is that if I could do this on my own, that vision, that mission is far too small. Understanding that under the leadership and direction of the Association of Black Cardiologists, this movement, this optimism, this vision is attainable. Thank you.